So, I mean, just to get right to it, I mean, quite often, as I kind of said earlier in the show before you got on, there's people who always say that Canadians don't want any change in their health system. They're afraid of change. They want the status quo. They only want to spend more money on it. But when you've asked Canadians directly, they sound a little more receptive to some reforms than some people would make you believe.
Yes, for sure. It seems to be a case where Canadians are ahead of the politicians, and some of the polling that I've seen over the years suggests that Canadians have been ready for health reform for a long time now. Now, if we had been talking about 20 years ago, I think it was a different topic because people would talk about things like having private clinics outside of the public system, and it was a lot more taboo. Whereas I think over time, Canadians have had an opportunity to read lots of opinion columns, see lots of interviews, hear lots of discussions about different healthcare systems around the world, and understand that it's not an either or situation. We can have a universal public healthcare system, which is what Canadians like. This idea you can walk into a hospital and receive some kind of significant procedure and then walk out without facing a big bill. We can keep that option in place, but at the same time allow patients the choice. So if they don't want to wait a long time to get their knee or hip done, maybe they could go to a private clinic and pay privately. Governments could work with private clinics to reduce backlogs, all kinds of different reform options. Canadians, I think, are understanding that these things work in other countries that are not called the United States. That we could bring them here. And that's really what our poll shows, is that Canadians are very much open to health reform if it can help patients.
Yeah, I mean, as you pointed out, not the United States. I mean, speaking of, when we talk about a lot of binary, non-binary stuff, well, our healthcare isn't a binary discussion with systems. There's dozens of systems with a lot of innovative ideas. Some systems stink, some are very good, but we really have shunted our discussion and kind of closed it down for looking anywhere outside of North America, and that's putting us at a disadvantage.
Oh, 100%. That's why I say not the United States, tongue in cheek, of course, because for so long, opponents of health reform, people who like this sort of pseudo government monopoly, they don't want to lose any control. So they've effectively tried to position this as Canada's system or the US model. But as you just noted, there's tons and tons of countries around the world with universal healthcare systems. We could be learning from them, understanding how they're delivering better care. And, really, I think that's what we need to do as a country, is to start to look at, what's happening in Sweden, on Australia, New Zealand, many other countries around the world that have that universal aspect that Canadians like, but ultimately deliver better results for patients.
Well, that word's the key part, because I think that's where a lot of the fear-mongering and misunderstanding comes. I mean, nobody's proposing to end the universal aspect of it. Nobody's saying we want to make it where if you don't have cash in hand, you won't get coverage. I mean, most people fully agree they want a system where you never have to sweat paying the bills because you need health care. So there'd be universal coverage. It's just changing how it'd be managed and delivered.
Yeah, exactly. And, even if someone did want to completely get rid of healthcare as we know it, it's a non-starter politically. There's not a single member of parliament in Ottawa that would stand up and say, let's get rid of it. There's no provincial government in the country, no major political party with any seats that would campaign on this. So politically, it's just not, it's pretty much impossible at the moment. And I would say for the foreseeable future, I don't think it's on anyone's radar. But yeah, like you said, I mean, we can reform the system and make sure that we keep that universal aspect that Canadians absolutely want, and find ways to deliver care better. And we threw out a couple ideas in our public opinion research to ask Canadians, well, what do you think about these ideas? So as I mentioned, this idea of keeping the universal public healthcare system, but if a patient doesn't want to wait, say, a year in chronic pain for their hip operation, well, allow them to go to a private clinic where they could pay out of pocket. And a majority of Canadians support that idea, about 51%. So, we've seen that in the past, majority support that. I think the public is there, especially when they start to understand what that actually means. I mean, there's ways that other countries have put safeguards in place. The boogeyman argument is always that, well, everyone's going to leave the public system and go and work at the private system. And obviously that's not the case, because other countries successfully do this, and they often have some safeguards in place to say, okay, you can't work at a private clinic until you've done X number of hours in the public system each week or whatever. But one important thing about this is that right now, a lot of surgeons will tell you that they have time on their hands, at least certainly before COVID, when all these backlogs emerged. But they had all this time on their hands because the governments wouldn't hire them to pay them what would be full-time work for a surgeon, they would only ration out a certain number of hip operations a year. So once the surgeon's done all those, he or she has time to kind of twiddle their thumbs, so to speak. So, there's certainly a lot of capacity within existing time that surgeons have to be able to work in both systems. And ultimately, that would lead to more procedures being done, helping patients and so forth.
Yeah, well, that's where some of the, I mean, that's kind of the lowest you found in reforms, though, is the 51% talking about allowing people perhaps to pay to get in ahead in line. But, I think with more discussion, if people realize and they frame it the right way, they can embrace that. Like the way I look at it is, okay, I've been told I'll get my knee surgery in 6 months. But if I let that guy pay cash and get ahead of the line, my surgery would be reduced to 4 months. So if I could just swallow the envy, yes, he got in tomorrow, but he subsidized my getting in 2 months faster. Like, I'm winning here. This is okay. And if people could kind of wrap it that way rather than trying to think of somebody jumping the line, I think you'd see more people realizing this is a better way to go.
Yeah, it's an absolutely huge benefit if we did that, because other patients would get to move ahead faster in line. It would also increase competition and innovation. When you have two different people doing the same task, well, that increases your chances that maybe one of them will find a better way to do it, and then they can both learn from it. I mean, this is how economies work in every industry, right? You see constant innovation over the years as new technologies are established and so forth. And, like I said, we got 51% support. I think if we had to maybe rephrase the question a little bit to make it clarified that, it would involve keeping the public system, but allowing this on the side, I think that the public, if they fully understood what this is, I think we'd see support to be actually a lot higher. So it is, it's something I'm thinking about the next time we pose this question, is to reframe it a bit. But I think certainly the majority of the public is there.
Yeah, well, and one of the areas we had a stronger showing of support, or perhaps the strongest, was 72% support copying that European Union policy that allows patients to visit facilities outside of their provincial borders and get reimbursed later. And I mean, that one, I guess, if a province has, to say, a specialized clinic that has extra room in it, they can bring people from next door and then get reimbursed from the province later, and it still gets the faster care. It's sort of that sort of concept.
Yeah, it would depend how they implement it here. But I mean, you've done a pretty good job of explaining it. So the way it works in Europe is, let's say you're in Ireland and you're facing a 4-month wait for your knee surgery. And when the government would provide it to you, it would cost them, let's say, just to pick a number, 5,000 euros. Well, what you could do is, instead of waiting that 4-month waiting period, you could maybe go to another EU country like France and pay, let's say they're charging 4,000 or 5,000 euros for it. Well, you go there, you pay it, you come back to Ireland, the Irish government reimburses you for what you paid. Now, if you found a better deal and you paid less, let's say someone went to Estonia and got their knee surgery done there, well, then the Irish government would actually save money, because they would pay you that lower rate, the amount you actually paid. And then the opposite of that, of course, is if you went somewhere and you had to pay more than what your government would normally pay, well, then you would be responsible for the difference. But just having this funding mechanism in place for patients right now, to be able to go abroad and get the care they need instead of spending another year in chronic pain, off work, whatever, Canadians like this idea. And it's a way to get relief for patients immediately, to give them that option. It wouldn't be forced, to be completely voluntary. Patients would have that option. Not everyone's going to take the government up on it, but as we just talked about, when that happens, let's say the government subsidizes someone to go to wherever, Tennessee, to get their hip done, well, then they go off of the public waiting list, and whoever's behind them in line gets to move up a spot. So, I mean, this policy is not perfect, but it's one I think that could help immediately reduce waiting lists in Canada. And at the same time, you'd help patients who decide not to go abroad for surgery. They would all get to move up in a spot in line. So, the big question with this policy, Corey, is, well, what's the cost? And if you think about it, over a 2 or 3 year period, the cost is, there's no real increase, because what you're doing is you're changing the timing of when expenses occur. So instead of paying, say, $5,000 to, fix your knee next year, the government would spend $5,000 this year. So over a 2-year period, the expenses are roughly neutral.
Yeah, and I mean, again, you see some of the concerns that come up, and it's fair enough. One of our commenters, Lori Dobby, saying the issue she sees is she or he, it's hard to tell, would be if people with money would be able to displace others in a wait list. And we sort of addressed that earlier. If it's shortening the list overall, it won't displace people on the list. It would just mean somebody else. But the waiting list, though, at least, in addressing that, that's the problem. That's where our system is bottlenecked. And maybe if people understand too, like as you're speaking about, that the costs of somebody waiting, if somebody can't go to work because they're injured or sick, or they're only part-time, or they're not as productive. Another thing is they're being medicated, quite often pain medication, and that can lead to addiction or long-term issues, as well as quality of life. Like, we really need to cut those waits and start to examine how we can do it.
Yeah. And, I agree with your point and Lori's. I think you both made good points there. Like you said, everyone could benefit, because people ahead of you in line who decide to do this, well, they get off of the waiting list. Everyone else gets to move up a spot who's behind them. Lori makes a good point, though, about cost. I mean, that's true. If, let's say that you need a $30,000 hip operation somewhere, and you don't have access to being able to pay for that before you get reimbursed. That is a limitation, obviously, of this policy. But what this policy does do is, if you think about it right now, who has the money to go abroad for healthcare? Because we know hundreds of thousands of Canadians every single year are flying to other countries, they're driving across the border to the US. People with access to money are able to do this right now. And it's sort of the lower income and lower middle income people that often don't have the funds to be able to do that. This policy changes that. It gives them an opportunity to go abroad and get a subsidy, if not full cost coverage, for the procedure they require. There's a patient, I'll just give this quick anecdote. There's a patient from Manitoba named Max Johnson, and the CBC highlighted his story. What happened with him is he needed a knee replacement, and it was going to take, I think, something like a year or so waiting list in Manitoba. He ended up going to Lithuania, and after he paid for his knee surgery there, he compared that with what the Manitoba government would normally pay to get that procedure done for him. And he calculated that it was about $7,000 less in Lithuania. So if the Manitoba government had been subsidizing people to go to Lithuania for their knee surgeries, the government could actually save money. Patients who may not have, whatever amount of money to go abroad, if they had this subsidy in place, they might then be able to start to afford it. So, again, it's not a perfect solution, but it is a policy that could help right now. We're in a crisis. We need to think outside the box, and I think we need to pursue options that may not be 100% right on the money, but maybe are 90% of the way there. And I think this is one of them.
Well, I see you took advantage of, when you're doing the poll. The polls are expensive, especially when you get 1,500 people like that through, a good polling company. So you want to get all your questions in that you can. But this one's interesting. We're saying 66% believe that health ministers should have to hold a press conference every year and announce the number of patients who died the previous year due to long waiting lists. And, that's kind of getting outside of talking about the systemic reform, but a nice way to point out, like, people maybe don't realize just how backlogged the system is. I mean, if you've been fortunate enough not to have health issues, not have to wait for anything in the system, nobody in your family has had a problem, you might not realize how bad it's getting out there. So having these health ministers get up and tell you, by the way, this many people would be alive today if we could have sped up the system, it might add a little fire under some butts.
Yeah, it's a real serious problem right now, and this is you're right. This question's different from the others in that it's driving at accountability in the system. It's a sad fact that every single year there are patients in this country that die because the government made them wait too long for healthcare in Canada. Remember, the government has a monopoly on it. You cannot go to a private clinic and get a heart operation in this country because the government won't allow it. So the government is taking complete control over your access to healthcare. And when they essentially force a patient to die in a way because they're not able to get that care they need in time in Canada, well, that's a pretty serious problem. We've been trying to dig into this information. We do reports every year that are called Died on a Waiting List reports. And we gather government data on how this is happening. It's a bit difficult to get the numbers because governments don't track it very well, but it's a very serious problem. And so we've asked this question, well, should health ministers should have to stand up each year and explain to the public how many patients died under their watch because they had to wait too long? And this option is overwhelmingly a popular one with the public. Like you said, 66% agree with it. It's just a good accountability measure. I mean, obviously politicians love to get in front of the cameras and attract lots of attention when they're building a new hospital, when they're hiring new staff, whatever. They like to get a lot of attention to the good news. This would obviously be an accountability problem in some cases. The public wants to know about it. That's, I think, what that number shows.
Yeah, and now another thing that's interesting when we're talking about private clinics, is the pandemic crisis. I mean, that led to a lot of hospitals basically locking down. A lot of procedures got put off and pushed off because they were trying to quarantine the hospital spaces. And maybe there's this is kind of going outside of what your poll was asking about, but still, if we had a number of specialized private clinics, whether it was for dialysis or orthopedic surgery or other day surgeries, those areas could have continued to operate while the hospitals were still locked down with vulnerable patients within them. But because we have everything packed into a few giant hospitals, it made us a heck of a lot more vulnerable when a pandemic came around. I'm just saying that there's benefits we could see from spreading our system out a little more rather than having it packed into one central location like that as well.
Yeah, you're 100% bang on. This is a very serious problem, I think, in Canada, is that so often when you need to get your knee or your hip done, or maybe you're an expectant mother and you're giving birth, you're going into that hospital building. Often it's the same building and complex where you've got people going in because they've got COVID or the flu or some kind of other disease or something that can spread. And sometimes those infections happen, right? And when you keep the healthy people, if you're pregnant, you're healthy. If you need your knee done, you're healthy. You have this other problem, right? You're not contagious. So if you had those procedures taking place in private clinics, at least if you had that option, then I think you could help spread some of those viruses and that from being transmitted.
Yeah, well, we're kind of, going, I guess, a different route. Rather than lobbying the politicians, you're talking to the public. Because as you said, the public's kind of ahead of the politicians on this one. If they can realize there's an appetite for this among the electorate, maybe they'll be ready to take it on. But I mean, there's clashes that could come with the Canada Health Act. So would it be time to start calling for maybe reforming that act a little to allow a little more flexibility?
I think so, yeah. And I mean, you talked earlier about the funding of healthcare in this country and how it used to be sort of 50-50. Now it's down to 20-some% that the federal government's contributing. The vast majority is coming provincially. The great hindrance is that when provincial governments try to experiment a bit, we talked earlier about innovation, when they try to innovate and try doing things differently to try and improve services. Well, if Ottawa doesn't like it, they can come in with the hammer and say, well, we're going to cut your funding. Now, it's only 20%, but that's 20% that provincial governments need. So, if you did reform the Canada Health Act, I think you could make sure some of the language is clear so that provincial governments have the opportunity to innovate while keeping that universal aspect that, Canadians overwhelmingly like. So I think there's an opportunity to reform the Health Act. And if you did, you could ultimately improve the outcomes for patients.
Well, and we have to start with somewhere. As I said, the politicians will move when their own electoral butts get on the line. So, you guys are doing good work and getting the public working up on it, and realizing that we've got to examine new things. You've been doing other things with Second Street before I let you go too. Your Survivors of Socialism series and a number of other things. Do you want to let us know a little bit more about the work you do before you go?
Sure. Yeah. Like you said, we did a series called Survivors of Socialism, where we talked to Canadians who came from socialist and communist countries, where we heard their stories. And we also surveyed them to say, are there any policies in Canada that concern you, because they remind you of the countries that you fled? And so, yeah, we got some interesting responses there. People can check that out. We've been doing public opinion research on the oil and gas sector and what Canadians think about developing and exporting more of our resources so that the world can buy from us instead of Russia. And obviously the huge benefit of that is if the world doesn't have to keep giving money to Putin for energy, well, then he has fewer dollars to buy tanks and rockets and invade countries like Ukraine and what other countries that may be on his list to invade next. So we've been doing projects like that. We've got lots of stuff on our website, and obviously people can find it at secondstreet.org.
Excellent. Well, I always appreciate you coming in. I really liked the poll you did, and getting some of that good information directly from Canadians. So thanks for coming on to talk to us today about it, and keep up the good work.
Thanks a lot, Corey. Appreciate it.
The current Lethbridge feed grain prices are as follows. Cash barley is at $4.55, Feed wheat's at $4.74, and corn's holding at $4.77 per metric ton. In the milling wheat markets, December Minneapolis futures lost 2 3/4 cents at $9.46, with local hard red spring bids for December movement at $12.25 per bushel. In the oil seeds, nearby canola futures increased $2.10 at $8.96.90 per ton, with delivered values for December trading at $20.11 per bushel. In the pulse markets, nearby red lentils are remaining at 34 cents, and yellow peas are trading at $13 per bushel. In the cattle markets, December live cattle gained 40 cents at $151.80 per 100 weight. For more information on grain marketing, call me at 403-394-1711. I'm Sean Smith at Marketplace Commodities, accurate real-time marketing information and pricing options.
Canadian Shooting Sports Association. Without the CSSA, our gun rights would have been taken long ago. These guys are on the front lines helping to draft smart and intelligent firearms regulations and legislation in Canada, and more importantly, educating the public about how we keep guns out of the hands of the wrong people. To become a member, it's absolutely worth every penny. You can become a Western Standard member for just $10 a month or $99 a year for unlimited access.